What's up, beautiful people? This is Dr. Precious once again. How are we doing? I'm sure we are doing fantastic. Well, today I am here to answer a question from the last video. I asked for questions to be dropped in the comment section, and I did get several questions. So I'm going to answer one of them today, and the rest will be answered accordingly. Well, today the question is coming from Adora, and she wrote, "My mom has pains at her hip area. It caused her to bend with stick while walking." Well, I'm assuming Adora is asking about what could be the cause of this pain and what can be done about it, perhaps. Well, hip in the pain is not very uncommon. It can happen to the young, it can happen to the old. Okay? It can be caused by so many different things. I'm going to try to keep it simple and keep it brief today. Okay? Now, pains in the hip can be caused by bone, can be caused by the structure surrounding the bone, the muscle, the joint, etc. Now, when it's bone related, it could be several things as well. It could be because of a fracture. Yes, bone can fracture. It can just break for whatever reason, maybe injury, accident, etc. It can dislocate. There can be dislocation of the bone. It can also have tears. So these are things that can cause pain in the hip. It can also be arthritis. I'm sure we have had the term arthritis severally, especially rheumatoid arthritis, okay? That is more like inflammation. Now, it can also be caused by the nerve that sends signal from your brain to the parts of your body. And if that nerve is pinched or is pressured in any way, it can cause pain in the hip. There can also be something called necrosis. When blood is not flowing properly to the hip area and is not getting enough blood, the tissue can die, or other things can happen to it. This can also cause pain in the hip. Now, there is cancer of the bone involved. There are several other things, but we're going to stick to the most common ones, okay? So these are things that can cause your mom to have pain in her hip. Now, what can be done about it? The very first thing to do is to figure out what is causing the pain. That is the only way we can have a proper diagnosis of what is causing the pain. Now, your mom needs to be taken to a doctor, okay? The doctor can do several things. He can do physical exam, do blood work, and of course, get more information, because the information given here is not enough to be able to say this is exactly what is causing the pain, okay? We have to know the age, was there any injury, and things like that. But now, when your mom is taken to the doctor will do a physical exam, will do blood work, maybe get more history, and if needed, the doctor can also order or send your mom to somebody that can do imaging. Imaging means x-rays, CT scans, ultrasound, and things like that, where they can actually look inside the body. Okay, once all this is done, that is the only way the doctor will be able to gather all this information and be able to make a diagnosis. A diagnosis means saying this is what is wrong, or this is what is causing the pain in the hip. So once that is established, the doctor can do several things. Both your doctor and your mom and the patient, because it may be somebody else, will now have to discuss, and the doctor may decide to manage the situation conservatively. Conservatively means just managing the pain and trying to, keep the disease process from progressing. It can also be a severe situation where surgery may be needed. The surgery that is used will be called hip replacement. So the doctor will be able to determine that. Let's assume the doctor decides to manage the situation conservatively. There are things the doctor can do, okay? The doctor will be able to give your mom or refer your mom to get some drugs to manage the pain. The drug that I'm familiar with in this side of the world will be called acetaminophen or ibuprofen. I'm sure in other parts of the world they might be called something else, and those are the drugs that the doctor may tell your mom to use, okay? And there may be other things that the doctor will recommend for your mom to do, maybe some home remedies to help alleviate the pain. For example, rest, okay? Don't stress the hip, rest, sleep positions, okay? The doctor might recommend to put pillow in between the leg to help balance the hips. There can also be, depending on if it's acute or chronic. In this case, it looks like it's chronic because it's something that has been happening for a while, okay? The doctor may also recommend heat pads, to place heat pads on the area. This can be done several times. A warm bath will also be beneficial, may help alleviate the pain, okay? So these are things that can be done. The doctor can recommend for your mom to do to help alleviate pain. Now, let's assume that it's something that cannot be managed conservatively and surgery is needed. The doctor will be able to direct your mom accordingly on how to go about getting the surgery, okay, to get a hip replacement surgery. And also, there are some things I want to mention. Before, the doctor may also, either before or after surgery, recommend for your mom to start seeing a physical therapist, and even plus or a chiropractor. So these are all different areas of medicine that can manage a situation like that, okay? So that is basically what it entails. There are several things that can cause the pain to happen. It can be bone related, joint related, muscle related, etc. And based on what is causing the pain, after the doctor must have determined the cause, we determine the line of action. It can be a conservative management or it can be surgery. And then there are other areas of medicine like chiropractors, physical therapists that the doctor will also recommend for your mom to see. And with all these disciplines, they will come together to be able to provide a comprehensive treatment plan for your mom to be able to manage the situation. Okay? I hope I have been able to shed a little light on things that can cause pain in the hip and what your doctor may recommend. Okay? Thank you so much. Thank you so much. Bye.